before we talk about the ovarian tumor or ovarian cancer or some of the ovarian masses, let's talk about anatomy of the ovary, some of the relevant point regarding ovary. See here, ovaries are pair of female primary sex organ which are situated in the pelvis. So they are known as female gonad. They are the female gonad because ovaries are producing ova or the egg. In adult, they are almond shaped and measures about 3 times 2 times 1 centimeter. So this is a measurement of the ovary in case of female. It is only intra-abdominal organ not covered by peritoneum. So this is one important point. And ovary is held in position by the two ligament, ovarian ligament, which attaches ovary to the cornu of uterus. Now, cornu is the area near to the fundus. Okay, from where the fallopian tube will start. Actually, that area is called cornu. So ovarian ligament will also attach there, and suspensory ligament which attach ovary to the lateral wall of the pelvis. So these are the two ligaments which are supporting ovary there: ovarian ligament and suspensory ligament. Now see there, see this picture. It is very clear in this picture. This is the uterus. Okay, here is the fundus of the uterus. This is the cornu of the uterus. This area is called cornu. Here is the fallopian tube, and this is called ovarian ligament, also known as utero-ovarian ligament. Here is a suspensory ligament now. Okay, so suspensory ligament is uh, suspending the ovary on the lateral pelvic wall, whereas this ovarian ligament is attaching ovary onto the cornu of the uterus. So ovary is supported nicely by these two ligaments. There is a broad ligament. Broad ligament has a lot of fat, so it looks yellow in color. Now these are the blood supply, okay, of ovary. Okay, ovary is mainly supplied by ovarian artery. Ovarian artery. Okay, and ovarian artery is a branch of which artery?
Sir, rises from the aorta.
Excellent, very good. Just
Aorta.
like very good. Just like testicular artery, ovarian artery is also directly originated from the aorta. So this is a gonadal artery. Okay, so ovary is here, isn't it? Ovary is here. These are the different ovarian artery branches. See this? Ovarian artery is coming here. So these are the different branches. Ovarian vein is here. This is called pampiniform venous plexus, just like in testes. This pampiniform venous plexus is here also. So it will combine together and form bigger type of ovarian vein, and which ultimately drains backward. Now this ovarian artery anastomose with the branches of the uterine artery and supply this whole area here like a fallopian tubes. Okay, this uterus, the side of the uterus, all these things are supplied by these two main arteries here. Now we are entering into the main part. This is what the students should know. What are the functions of ovary? Okay, and what are the structure of the ovary? Which hormones comes out from the ovary, and how the functions of the ovary is controlled. So ovary has got two important function. See this: endocrine function, that is production of the hormone like estrogen and progesterone, and formation of egg or ova. Okay, formation of egg or ova. You can roughly call it exocrine function actually, and that is production of mature ovum, also known as oogenesis. Oogenesis is the process of formation of egg. Now let's talk about the structure of the ovary, then everything will be clear. Now in this discussion we are going to talk about what are the different stages of follicle, ovarian follicle. Okay, what happens when it is mature and how ovulation occurs. We are going to talk one after other. Now I'm talking about structure of ovary here. Okay. Now, first, when we do a cross section of the ovary, then we can get two zones in ovary. The outer zone is called cortex, and the inner zone is called medulla. But actually, this medulla is very ill-defined zone, very ill-defined one. Cortex is the major part of the ovary. This cortex contains ovarian follicle and cellular connective tissue. Okay, cellular connective tissue and ovarian follicle. There are some important terms which you come across like theca. Okay, these theca are special types of connective tissue cells which are responsible for the production of androgen hormone there. Okay, and later on that androgen hormone will be converted into estrogen. That is another thing. But these are the functions of connective tissue cells. Now, whereas the medulla, also known as zona vasculosa, has many blood vessels and nerves. It doesn't have ovarian follicle present in there. So follicles are only present in the cortex. So cortex is outer part, medulla is the inner one. Now see there. So these are the different phases of the follicle development. These are the primordial follicle. Okay, primordial, the earliest one, then primary follicle, then the developing follicle. Okay, when they are a primary follicle developing into secondary, okay, these are the developing follicle there, and the mature follicle is known as Graafian follicle. Okay, mature follicle is known as Graafian follicle. When the time of ovulation comes, under the effect of luteinizing hormone, this Graafian follicle will rupture and the ova or oocyte comes out, and the remaining part of the Graafian follicle will be converted into corpus luteum. Now you all know which hormone comes out from corpus luteum, isn't it? Which hormone is that?
Progesterone.
Progesterone, sir.
Excellent. It is progesterone. Okay, that progesterone is necessary for the implantation of the zygote, because that time the female, the lady, may become pregnant. So the situation of the environment should be favorable for the implantation of the zygote. That is done by progesterone. Okay. Now after the menstruation occurs, now uh, menstruation occurs only when there is no pregnancy, isn't it? When pregnancy fails, means that everything will be shedded outside. So after that, the corpus luteum will also shrink in size, and that is known as corpus albicans. And this is the medulla. So this is a very beautiful type of diagram which is explaining a lot of things to us. Let's talk a little bit in detail here. These ovarian follicles are located in the cortex. We all know that. Okay, and are composed of oocytes, which are surrounded by follicular cell. Follicular cells are also known as granulosa cell. So oocyte is present in them, and that in the developing stage. Approximately, okay, 400,000 follicles are present in the newborn ovaries. Only a small percentage of the oocyte, approximately 450, reach maturity in the adult, and all other will remain inactive. See this? Out of 400,000, only 450 reach maturity in the adult. Now the remaining follicles eventually inactivate and degenerate through a process known as atresia. Atresia may occur at any stage of follicular development. Now this is very interesting. Okay, let me tell you a little bit more about this concept here. Now why a older lady, okay, if she conceive, has high chance of giving birth to the anomalous baby, or those baby who are having congenital anomaly. It is all about this concept here. Okay, please listen carefully, because these ova are getting older and older day by day. Remember, these ova or these follicles are already present at the time of birth. They are there throughout the life of that lady, and when all of them degenerate, only 450 remains there during the pubertal time. Now, what does that mean? When that lady becomes older and older, all these ova will also become older. That means there's some chance of mutation and things like that. That's why the older lady should not conceive. Okay, should not. There is no absolute thing here. We have seen even a 50-year-old or 55-year-old lady, before menopause definitely has given birth to the baby. We have seen that, but that is full of danger. There is a high chance of trisomy and other types of congenital anomaly occurring, and this is because of this mechanism. Different types of ovarian follicle are found during the ovarian cycle, namely the primordial follicle, primary follicle, secondary follicle, and Graafian follicle. Okay, so what are these? Let's talk one by one. Let's move on. Look at this picture and the slide now. Primordial follicle. This is primordial follicle. In this follicle, this is the primary oocyte. Okay, primary oocyte, which is surrounded by a single layer of flattened follicular cell. It's a single layer. So this is primordial follicle. Primary follicle, on the other hand, has one or more layers of the cuboidal like follicular cell. See this? Okay, a little bit bigger looking cell, and here is another layer. Okay, one or more layers are there. Now, after this, we have the secondary follicle. Secondary follicle, also known as antral follicle. This is the antrum. Antrum is a cavity. This is a cavity which is formed inside the follicle. So there are different terms here now. I'm sure you are already familiar when you study your embryology. A layer of polysaccharide called zona pellucida forms around the oocyte. See this? There is a nucleus of the oocyte. Okay, it's called primary oocyte, and this is called zona pellucida. Zona pellucida. This is made up of a polysaccharide or carbohydrate. The follicular antrum, this antrum is a cavity, has developed by fluid accumulation between the intercellular spaces, and it is important for the nourishment purpose. Follicular cell change from flat to cuboidal and proliferate to produce a stratified epithelium of granulosa cell, and these are called granulosa cell here. These granulosa cell are so important. First of all, they secrete these important types of fluid. Okay, and another one, they help in the maturation of this ovum. Okay, all these things are there. And third one, when the thecal cell means they are the connective tissue cells. When they form androgen, this granulosa cell may convert, okay, those androgen into estrogen as well. So these are different functions. Now the mature one is called Graafian follicle. It's a mature follicle that extends through the entire cortex. And you all know every month, okay, one Graafian follicle is matured, and that is responsible for ovulation. And another month, the another ovary will release the ova. So it is a bit of alternate things there. In Graafian follicle, the antrum becomes enlarged. You can see that it is almost full of the antrum. See this? This whole thing is the antrum now. Okay, these are the granulosa cell on the wall. Okay, and these are the theca interna and theca externa. The granulosa cell surrounding the oocyte is known as cumulus oophorus. Cumulus oophorus. This cumulus oophorus is present here in this area. This area is called cumulus oophorus. That means the layer of the cells, the granulosa cells, which are in between the ova, okay, and the antrum is called cumulus oophorus. Connective tissue surrounding the follicle develops into theca interna and externa. These are connective tissue, of course. And theca interna produces androgen, which are converted into estrogen by granulosa cell. Okay. By now, you must be clear regarding this function. Now, what do we mean by ovarian cycle, and what happens during, ovulation? Let's talk about it. Ovarian cycle is a periodic shedding of an ovum and a regular maturation of ovarian follicle in cyclical manner is known as ovarian cycle. So, if the menstrual cycle is 30 days, let's say 30-day cycle, exactly on the 14th day, the ovulation occur. 14th day, that is 14 day prior to the menstruation. Okay, and this whole cycle, now what happens before that period of ovulation? What is happening? What is happening after ovulation? So all these things is called ovarian cycle. So the phases of ovarian cycle are follicular phase, ovulation phase, and the luteal phase. Now let me clarify once again. Ovulation occur exactly, okay, 14th day prior to the menstruation. Now before ovulation is called follicular phase, and after ovulation occur, it is the luteal phase. So in follicular phase, there is development of the Graafian follicle. When it reaches at the maturation state, then it ruptures and the ova comes out. That is called ovulation. After ovulation occurs, the remaining part of the Graafian follicle will undergo into corpus luteal development. So that is called luteal phase. So this is the way to remember. Now let's elaborate a little bit more. What exactly is the follicular phase? In follicular phase, around 5 to 15 primordial follicles starts to develop under the influence of FSH, follicle stimulating hormone. And from where follicle stimulating hormone comes?
Interior
Yes.
pituitary.
Pituitary, sir.
Anterior pituitary.
Anterior pituitary.
Excellent. From the anterior pituitary. Very good. FSH and LH are the hormone which are released by anterior pituitary, and they help in the development of these follicles. A single primordial follicle gets mature and converted to Graafian follicle. So only one is chosen, and it's a random type of choice. So in the beginning, 5 to 15 starts to develop a little bit, but ultimately only one will be selected, and then it will be gradually developed into the primary, then secondary, then Graafian follicle, and then it will get matured. Estrogen is secreted during this phase by the granulosa cells which are present in the Graafian follicle. So this follicular phase, okay, the hormone which comes out is estrogen. Don't forget that. So what this estrogen is doing on the endometrium, okay, that is called endometrial cycle. We are talking about the ovarian cycle now, okay? But ovarian cycle and endometrial cycle are very closely related with each other. Well, what I'm saying here is, what is the effect of this estrogen on the layer of the endometrium? That also you need to remember. And that is called proliferative endometrium. It just increases the thickness of the endometrium. That is called proliferation. Now, second is a phase of ovulation. What happens there? An increase of antral fluid causes an increase in pressure on the wall of the follicle and on the surface of the ovary as well, and the follicle eventually ruptures. And that secondary oocyte, along with the cumulus ovorus, passes out of the ovary. Means there's a rupture of the ova now. The ova must be fertilized within the 24 hours or it degenerate. The average is 24 hours, okay? Sometimes it may be longer than that. Sometimes maybe 72 hours. So this is the period when, if sexual intercourse occur, the lady may be pregnant. So it depends according to the menstrual cycle. So let me clarify a little bit here. If the menstrual cycle is very regular, every 30 days, okay, the menstrual cycle is repeating, then we can really know when the lady is ovulating and what is the danger period to get pregnancy. But if the cycles are irregular, then it is very difficult to guess when is the time for ovulation. Okay, so a bit of precaution should be taken just to avoid pregnancy during that time. Ovulation occurs due to LH surge. This is luteinizing hormone surge. This is very interesting mechanism. So let me explain this. Please, pay attention here. Now, what happens just before the time of ovulation? Okay, the estrogen which is released by these granulosa cells, okay, will not give negative feedback to the pituitary. Rather, it will give positive feedback to the pituitary, means it will stimulate the release of LH. This is a very interesting mechanism. In other time, it doesn't happen like that. It is a negative feedback mechanism, remember that. But this time, it will give stimulation to the more release of LH. This is known as LH surge, and this LH will act on the Graafian follicle and lead to rupture of the Graafian follicle, which is called ovulation. So LH is responsible for that. Now, what is the third phase? That is the luteal phase. Luteal phase is the synthesis of corpus luteum and all the functions of corpus luteum after that. It starts after ovulation and leads to the formation of corpus luteum from the ruptured Graafian follicle under the influence of LH. So again, LH is responsible for that. The theca interna cells enlarge and become theca lutein cells which secrete estrogen, and granulosa cell enlarge and become granulosa lutein cell which secrete progesterone. So still it is continue to secrete estrogen. Estrogen is the main female hormone, you know that. Okay, so estrogen was secreted before also. Estrogen is continue to be secreted after ovulation as well. But another hormone will come into the picture now, that is progesterone. See here. So this progesterone are secreted by corpus luteal cell. We have two types of cell there. These are known as theca lutein cell and granulosa lutein cell. Okay. Later on, when we reach to the discussion of some diseases, there is something known as theca lutein cyst. Okay, theca lutein cyst is one of the condition which is considered as the ovarian mass. We'll talk about that. So these are the important terms for us. If the ovum is not fertilized, what will happen now? Okay, the corpus luteum reaches its maximal development approximately 7 days after ovulation, and if the lady is not pregnant, means if the ova is not fertilized, then it begins to degenerate. Okay, it begins to degenerate. Now, that degenerated form of the corpus luteum is known as corpus albicans. Corpus albicans. So these are all very important terms for you regarding the MCQ exam. Corpus luteum degenerate after 12 to 14 days and become corpus albicans. But what if the ovum is fertilized? What if the lady becomes pregnant? See here, the corpus luteum persists until the 12th week before degenerating and is maintained by HCG now, human chorionic gonadotrophin, which is secreted by the developing embryo. To be rather precise, from where exactly this HCG is released? Yes.
Syncytial trophoblast, sir.
Very good.
Syncytial trophoblast.
Exactly. It is from
Syncytial trophoblast.
syncytial trophoblast. It is the outer layer of the trophoblastic tissue from where the future placenta is formed. So HCG is maintaining corpus luteum if the lady becomes pregnant, and it maintains till the 12th week. Okay. After that, the placenta will take over. Now, all this thing which we have discussed till now are so important. Okay, please revise them more than one time. Now see there. So this is again a few pictures here. This is the antrum or the cavity. This is the pre-ovulatory follicle, almost about to be ruptured. Here it is ruptured here. Okay, it has come out, and this is the corpus luteum. Corpus luteum.